Assalamu alaikum. I am Muayyad, the founder of the Golden Board of Urology. The Golden Board of Urology is a series of videos where we will discuss every case scenario that could come in any final urology board exam. A part of helping residents passing their exam, the ultimate goal behind creating this series is to spread knowledge and experience aiming to improve the patient's care around the world. Today we have Dr. Omar, who is one of the best physicians that I've ever worked with, and I'm really glad that he accepted my invitation to volunteer and to participate in this series. Thank you, Dr. Omar, and welcome.
حياك الله. Thank you, Dr. Mayed, for all what are you providing to us all.
No worries. So please note that this case is a 15-minute long scenario. You will have 1 minute to read the case and arrange your thoughts before we start. And also, please don't feel offended if I cut you or interrupted you, as it would be definitely in favor of you getting the maximum benefit out of the case. Are you ready to start, Dr. Omar?
Inshallah, let's go.
Okay, your time started.
35 years old male presented with penile swelling and pain for the past 8 hours. How to approach this case? So I will start with the history. Prior to this complaint started, was the patient had any trauma, or was he having any sexual intercourse? In case he is having sexual intercourse, did he hear any cracking or popping sound? I will ask about the pain intensity, and did he use any painkillers, and how is the response? Was it followed by any rapid detumescence? Regarding the swelling, is it associated with discoloration? And is it progressing or not? Also, I will ask about urethral bleeding, inability to urinate, and I will ask about the past urological history from intervention or similar episode before, past medical history and past surgical history. Then I will go to the physical examination. I will start with the vital signs.
Excellent. You can go to the local exam.
So I will examine his genitalia. Is there any swelling? Is there any ecchymosis? If there is any, what is the extent of that? Is there any blood permeatus or not? And the scrotum also, and the perineum.
Okay, what specific deformity is that related to this case, you think?
Eggplant deformity.
So the patient had a typical popping sound during the intercourse and lost his erection immediately afterwards. Examination showed a typical eggplant deformity. What next?
I will request CBC and PTT, and I will request penile ultrasound.
Excellent. So the laboratory workup that you requested was unremarkable, and the ultrasound showed the following. Can you describe the findings you see?
I see here a defect in the tunica albuginea along with pericorporal hematoma.
Excellent. I have a question for you. What if the ultrasound finding was equivocal? Would you add something?
Proceed.
Request something else?
I will proceed with MRI for further characterization.
Excellent. So please note that the MRI is not mandatory in this settings, but if you request it, it wouldn't be a wrong request.
Okay.
So we decided to take the patient for an immediate repair. Justify the urgency of your intervention.
Since he has pericorporal hematoma, it needs to be evacuated in order to prevent infection. Second thing, conservative management in such condition, it will prolong the hospital stay along with penile fibrosis and scarring.
Excellent. So you took the patient to the operation theater, and during the exploration, the penile defect could not be identified. What method will you do to identify the tonical buginal defect?
I will do an artificial erection looking for any leakage.
Thank you. Good. Okay, could you please describe your surgical steps?
Yes, I will start with placing a Foley's catheter. Then I will place a tourniquet to manage for intraoperative bleeding and to reduce that. Then I will make a circumferential incision at the circumcision site, and I will deglove the penis
Right.
to evacuate the hematoma, looking
Right.
for the lacerated tunica albuginea. Once it is identified, it will be repaired with an absorbable suture, then to close the skin.
طيب. How would your incision differ if the patient is uncircumcised?
In uncircumcised patient, there is a risk of ischemia of the prepuce. So we can proceed with the ventral vertical incision and penile degloving. And at the end of the procedure, just to do a limited circumcision.
Okay. So in operating theater, cystoscopy and surgical exploration confirmed that the patient has 1 centimeter urethral injury. What is your management?
So to dissect and the lacerated devitalized tissue,
Okay.
and then to repair the urethra with a absorbable suture over guide wire, watertight, tension free.
For a guide wire over Foley's
Over
catheter.
Foley's catheter.
Yeah, I know that you mean it, but it was just yeah.
Slip.
No worries. So what is your postoperative counseling and follow-up plan?
So Foley's catheter needs to be kept for 2 weeks. Then the patient to be followed with periurethral ascending urethrogram,
Excellent.
pericatheter. Needs to be abstain from sexual intercourse for 6 weeks.
Okay, good.
Yeah.
Some would add androcore just to suppress the erection in order to preserve or to protect the anastomosis of the urethra
Okay.
and the corporal sutures.
Okay.
So, what are the complications associated with penile fracture? Could you tell me, please, 2 or 3?
Erectile dysfunction, penile fibrosis,
Okay.
also penile curvature.
Okay, excellent. So, after 3 years, the patient presented to you with an inability to achieve a satisfactory sexual intercourse. What are the most important points to ask about in the history?
I will ask about the onset. When did it start since the surgery 3 years back? And is it due to erectile dysfunction or any other issue? The rigidity of the erection, the pain while he is erected, partner satisfaction, any curvature, the ejaculation, also the ability to penetrate the partner.
Okay, good. The patient has a stable penile curvature for the past 18 months. He's extremely unhappy with the deformity despite being able to penetrate. What would you do next?
I will examine the patient looking for any plaque or fibrosis.
Okay. So, physical
Yes.
examination of the flaccid penis revealed around 1 centimeter plaque in the lateral mid shaft. Would you add anything?
Yes, it's need to be examined while erected,
Excellent.
either with oral medication if he cannot achieve, or providing an image, or to inject vasoactive medication
Okay.
for
Okay, good. So the patient had 45-degree lateral penile curvature after you created an erection using intracorporeal injection, and he has a good rigidity and good penile length. What next?
So I will do ultrasound penile for him for assessment of the plaque that the patient has.
And to objectively assess his
Assess for AD.
exactly. Okay.
Okay.
So the ultrasound was done and showed 1.5 centimeter lateral plaque with normal peak systolic velocity and other parameters. So what would be your management options?
Oral medication, vitamin E and colchicine, intralesional injections, such as verapamil injection,
Okay.
shockwave, and lastly also the surgical management.
Okay. So the patient agreed for the surgical management for his penile curvature. What are the indications of the surgical intervention in a case of Peyronie's disease?
Passing 6 months of the and passing the active phase, the acute inability to achieve satisfactory intercourse, failed conservative treatment.
Okay. What are the most important points or complications that the patient needs to know about? Can you mention, please, 4 or 3?
He needs to know it may recur.
Okay.
He might lose some of the penile length.
Okay.
It might affect his erectile function.
Okay, excellent. Excellent, that's enough. So given the good penile length that the patient has, what is the most important factors to determine your surgical option?
The rigidity of the erection.
Excellent, that's good.
Also, yes, also if the patient is willing to losing some of the penile length.
Excellent. So the patient has a good rigidity and he accepts some length loss. What are the options for him?
Plication, which is the shortening procedure, Nisbet,
Okay. What else?
or also the Yakia procedure.
Okay. And the third is the dot procedure. Okay.
Okay.
Um, these are the shortening procedures. What about the other options?
Excision and graft.
Oxygen and graft. Okay. What if the patient does not accept length loss? What would you offer him?
I will counsel him for excision and graft.
Okay. Could you please tell me some of the type of graft material used?
There is the autologous, xenografts,
Okay.
synthetic, and
Okay.
also Tacocil
Okay.
can be applied as a graft after
Okay.
the excision.
Okay. So moving to the last question, what are the predictors of post-operative erectile dysfunction? Could you please tell me 3?
The larger tonical defects,
Okay.
the ventral curvature, also
Okay.
the age of the patient, if he is more than 55 years old.
Okay, excellent. Thank you, Dr. Omar, for answering the questions. You've done a great job.
Thank you, Dr. Mayed, and it was my pleasure.
Thank you. Thank you, Dr. Omar.